Implant Cardioverter. It's used to treat harmful tachyarrhythmia, which originate in the ventricles when the heart rate becomes too fast. It continuously monitors the heart for such arrhythmias and delivers a shock to return the heart to a normal rhythm when an arrhythmia does occur. Patients with this device will have a card which will have the information for what doctor to contact. Pacemaker. It's a device composed of a pulse generator and leads. The leads monitor the heart rate and provide the pacing impulses when necessary. It's used for the treatment of arrhythmias and irregular heart rate. If heart rate is fine, then the pacemaker does nothing until the heart rate slows, then it gives an electrical pulse to speed it up. Patients with a pacemaker should have a medical treatment prior to dental treatment. Electromagnetic interference can cause failure. If malfunction occurs, then all possible causes should be shut off and EMS should be alerted.
Asthma. Asthma is a chronic respiratory disorder in which there is increased responsiveness of the trachea and bronchioles to various triggers which result in narrowing of the airways. The bronchial inflammation in an asthmatic is a result of the body's immune response to an inhaled allergen. Triggers include air pollution, specific chemicals, and emotional stress. There are 5 classifications of triggers: extrinsic, intrinsic, drug-induced, exercise-induced, and infectious. Signs and symptoms of an asthma attack include difficulty with respiration, wheezing, speech limited to single words.
Help. Can't breathe.
Treatment focus is to maintain respiratory status as close to normal as possible. Have them use their prescribed bronchodilator. And have them sit upright and make sure tight clothing is loosened.
An obstructed airway is a common occurrence in the dental office. The most common item involved in obstruction or aspiration is food, but dental appliances are a close second. An airway can be partially obstructed or completely obstructed. Partially obstructed airway symptoms are coughing, wheezing, anxiety and fear. Completely obstructed airway symptoms are respiratory distress with the hands placed in the throat area. The patient will be unable to talk or cough, and eventual loss of consciousness. If consciousness is lost, the patient's airway should be opened and ventilated. If the clinician is unable to retrieve the item from the patient's mouth, the patient should be sat upright and encouraged to cough or given the Heimlich maneuver.